While light spotting can sometimes be normal in early pregnancy, heavy bleeding, similar to a period, can be a sign of serious complication. We all get headaches, but one that feels like the worst headache of your life can be a sign of high blood pressure or preeclampsia. Today, let's talk about some high-risk warning signs. I am Dr. Philip. Every pregnancy comes with its share of aches and pains, but sometimes your body sends signals that require immediate medical attention. Today, let's talk about some high-risk warning signs that should never be ignored. If you experience any of these, don't wait for your next appointment. Call your doctor or visit an emergency room immediately. Vaginal bleeding and fluid leaks. While light spotting can sometimes be normal in early pregnancy, heavy bleeding, similar to a period, can be a sign of serious complication, such as placenta issues or preterm labor. Second to that is leaking fluid. If you feel a sudden gush or a continuous trickle of clear fluid, your water may have broken too early. Please get medical attention immediately. Another sign is blood pressure and preeclampsia. Severe or persistent headache is a symptom. We all get headaches, but one that feels like the worst headache of your life or doesn't go away with rest and hydration can be a sign of high blood pressure or preeclampsia. Well, preeclampsia is when the blood pressure increases in pregnancy, and the woman can just come for antenatal and suddenly you just check the blood pressure and you see that the blood pressure is very high. While some other times they come with severe headache, and because of that very severe headache, you will love to check the blood pressure to rule out preeclampsia. And when you see it, hitting the roof, there is usually some dilemma in this situation, because once there is preeclampsia, it's difficult to stop that pregnancy. You have to bring out the baby for the woman to survive. So if you are lucky enough that the pregnancy is up to maybe above 29 weeks to above 28 weeks, then you have to rush to bring out that baby. If she's not in labor, you most likely have to do cesarean section to bring out that baby. And of course, that baby may require incubator. But in African women, the preeclampsia normally starts late. Quite a lot of times, you start maybe around 34, 36 weeks. So quite often, the babies survive. Another sign is experiencing vision changes. If you see flashing lights, dark spots, or experience sudden blood vision, your body may be reacting to a dangerous spike in blood pressure. As a pregnant woman, this is not a good sign. You must see your doctor. Occasionally, there are women who just come into the clinic, they're not even thinking, they're not aware that the baby is not moving well until you ask them, "Madam, how is your baby moving?" I remember a case like that. "Madam, how is baby's movement?" I say, "Doctor, I've not felt it since yesterday night." Oh my God. So we did what they call fetal kick chart for the woman, admitted her, and truly the baby's movement had reduced drastically. And then we didn't have a choice but to do an emergency cesarean section. And when we did that, that was able to salvage that baby. If the woman had not come that period and it was not identified, this could have led to the death of that baby, which is not good after 9 months pregnancy. Are you observing a decrease in baby's movement? Now, if there is reduced movement, that gives you, the woman, an ample chance to be able to bring out the baby or deliver the baby with baby still alive. The truth is that when there is no movement, it takes roughly about 12 to 24 hours before the baby will die. And that is why most times we're asking the woman to observe the movement of their babies. They're expecting at least to have up to 10 kicks in 6 hours. And as it's reducing, that is a dangerous sign. If it stops entirely and you do not come after 24 hours, I'm sorry, it may be very difficult to be able to salvage that baby. But if you are able to notice the reduction in movement, if you are able to rush to the hospital and they identify that truly this baby is not moving well, they will take an urgent intervention so that the baby's life can be preserved. Remember, it is always better to go in for a check and be told everything is fine than to wait and get into further complications. Maternal health is one of our focus area in Guinea Savannah Medical Center. We bring decades of experience in maternal health to give you the peace of mind you deserve. I am Dr. Phillips Uche Ekbe.